there, I'm Brooklyn Hill and I'm doing my injection skills video. I'm first going to show you the proper ways or the proper places to give the proper injections. I'm first going to start with the sub-Q, and sub-Q would be the back of the arm and the fatty part of the arm, and just pinch it and inject straight in between those. And then it'd be anywhere on the anterior or lateral aspect of the thigh, and then about 2 inches outside of the umbilicus. Anywhere around the umbilicus would be fine. And then next would be my intramuscular injection sites, and that starts with the deltoid. So you find the acromion process, about 2 finger breaths down, make a triangle and inject right in the center. Next would be the vastus lateralis. So I'd place one hand on the head of the greater trochanter and one hand on the lateral femoral condyle, and I'd inject in between those. And then next it would be the ventrogluteal. Can you stand up for me? And I will place one hand on the head of the greater trochanter. Let's see, let's do it this way. My thumb would go in towards the groin, and I would make a V with my pointer finger and my index finger and go right between those. Thank you, Haley. But before giving an injection, there's more to it. First, I would begin by doing my first check. I will check my MAR and my provider's orders to make sure that they match. After that, I will get ready and I will prepare the actual injection. So prior to preparing it, I would do hand hygiene. I would clean the top of my vial, and then I would open my syringe using aseptic technique, and I will also just open that just to have it. Open up my filter needle. My injection calls for 2 milliliters of ketorolac, and I would pull back 2 milliliters of air. Insert the air, turn it upside down. It kind of comes back on its own. Pull back 2 milliliters. Knock out any air bubbles that there may be. Change out my needles. So I change out my filter needle for an injection needle. I have 2 milliliters. Before going into the patient's room, though, I would perform my second check. I would again check the MAR and the provider's orders, and then I check my syringe and make sure that I have everything that that I need. Upon entering the patient's room, I would knock on the door. As soon as I went in, I would perform hand hygiene. I would ask the patient to state their name and date of birth, or I would check the armband. Then I would ask the patient if they have any known allergies, just to make sure that they're not allergic to anything that I'm giving them. After that, I would explain to them what I'm doing and why I'm doing it. And then I would ask if they have any questions before I actually gave the injection. At this time, I would also do my third check, and I would check, once again, the MAR and the healthcare provider orders and my syringe, just to make sure that everything's good to go. At this time, I would form hand hygiene. Apply some gloves. I would also maintain patient privacy by pulling the curtain or closing the door, whichever it may be, or both. And I will only show the area that I'm giving the injection in. I will clean the site with an alcohol wipe in circular motions. Allow it to air dry. I'd pull my skin tight or taut, and I would enter at a 90-degree angle, and I would aspirate. There is no blood. I would aspirate for 5 to 10 seconds. If there was blood, I would start all over again. I would have to redraw up the medication and unfortunately stick my patient again. And then I would inject slowly. Take out my needle. Put it in the sharp container. I would have also put my filter needle into the sharps container, and I would just apply gentle pressure, no massaging. I'd hold that for about 10-15 seconds. After I would give the injection and everything's good to go, I would help the patient get back dressed or pull down their shirt. I would cover the patient back up, make sure they're comfortable, give them their call light. I would put the bed in the locked lowered position to maintain safety. I would pull up side rails. And before I left, I would just make sure that they're okay, that they don't need anything. And then right before I left the room, I'd perform hand hygiene, and that'd be it. Thank you.